Hello, and welcome to Back to the Science. I'm Dr. Susan Oliver, and I'm a scientist. And sleeping on the job again is Cindy Oliver, and she's a dog. So, a little while ago, Dr. John Campbell made a video about a report that claimed 16.9 million people had died from the vaccine. Now, most of you don't need me to tell you that the claim is total bollocks. But you may be wondering how anyone would come up with such a ridiculous claim in the first place. So, in this video, we are going to have a look at that. You probably aren't wondering why John Campbell chose to repeat the ridiculous claim in his video. We all know that he will say anything to keep making money from YouTube. Sadly, not everyone knows that he's talking bollocks, and so he continues to cause harm with his videos. But anyway, let's have a listen to what he's claiming in the video.
We also calculated the population-wide risk of increased deaths per injection. Now, this is clearly talking about the COVID vaccine injections. They're able to make calculations on that as well. And here, 78 countries had sufficient data up to 20th of December 2022, 16.9 million COVID vaccination associated deaths. So what they're saying here is 30.9 million overall excess deaths projected for the global population, just over nearly 31 million. Of those, 16.9 million vaccine associated deaths.
Right. Let's ignore the crazy vaccine death number for a minute and look at the other number. So, according to the report, there were 30.9 million excess deaths from 2020 to the end of 2022. Now, a number of different studies have looked at excess death during the pandemic, and to the best of my knowledge, no legitimate study has come up with a number like this. For example, here's a chart from Our World in Data. They estimate excess deaths of 21.73 million at the end of 2022, with an upper bound of 27.53 million. So, where John's study got 30.9 million from is anybody's guess. But this pales into insignificance compared with the crazy 16.9 million vaccine death figure in the report. So, where did that figure come from? The first thing you need to know is the lead author on the report is a guy called Denny Rancourt, who has a PhD in physics. Dr. Rancourt is also a virus denier. He doesn't believe that viruses exist. So, of course, he also doesn't believe that COVID exists. He has therefore assumed that all the excess deaths that he claimed occurred after the vaccine rollout commenced were vaccine deaths. His argument is simply viruses don't exist, therefore there can't be any COVID deaths, therefore all deaths are vaccine deaths. And John presented this report with a straight face. You may be wondering what Dr. Rancourt thinks caused the excess deaths prior to the vaccine rollout. Here's a clip from a video where he explains it to Steve Kirsch.
And air is loaded with crap, right? Including bacteria, but when you are stressed, you don't even need the air to be dirty. You already have an entire universe of potential pathogens in your respiratory tract that can become lethal if they go into your lungs and you have a weakened immune system. So you don't need to transmit anything. You've got a zillion different pathogens, and what pathogens you have in your mouth or in your intestine or anywhere is completely different from person to person, depending on what you eat, what your habits are, what your breathing habits are, everything. So this is a complex system. And the biggest knob that you turn to decide whether or not people are going to be sick is experienced psychological stress and social isolation. What did they do? They turned up experienced psychological stress and they socially isolated everyone. Of course, you're going to have a myriad of medical problems, especially among the frail, especially among those who already have medical problems. So we showed in the United States, for example, that the people who died were in the poor states. The more poverty there was in the state, clearly that was correlated. That those are the people who died. Who are those people? They're also the same people who normally get 50%, sometimes twice as many antibiotic prescriptions as the regular population, as the average population. Guess what? They stopped prescribing antibiotics. So you've got all these stressed out people whose lives have been transformed, who normally get lung infections, who are going to get them again, and this time you're not treating them with antibiotics. And so guess what? There's going to be a lot of death, and there's going to be a lot of symptoms, and there's going to be a lot of different bacterial infections. There's going to be a lot of unusual symptoms that clinicians are going to say, and clinicians are subjected to the same propaganda, the same, we're all going to die from this novel pathogen. And so they're wearing those glasses, and that's what they see. And then,
Okay.
and then let me finish one more thing. And then some of these clinicians decide to use ivermectin. And guess what? Ivermectin is extremely powerful in aiding bacterial lung infection. It is antibiotic. Its antibiotic properties for bacteria that infect the lung are tremendous. So you've got this clinician now saving people's lives who have a bacterial infection and they're not allowed to prescribe antibiotics, and they save them with ivermectin, and they make the connection that therefore ivermectin saves you from COVID. Now, this stuff is happening on a large scale. What I'm trying to tell you, Steve, is I don't believe these anecdotes. I don't believe what clinicians say. I know from reading the historical documents that entire medical establishments in England and Wales can be fooled by newspaper propaganda and start writing things on birth certificates because they read about it in the paper. And this is not new. And so I do not believe this crap.
Okay.
I'm
All
sorry.
right.
I have
What?
respect for medical people, but they
Uh,
have to start recognizing that it's easy for them to fool themselves.
Okay. So let's just leave it here, because suffice it to say, I totally disagree with that,
Okay.
your assessment.
Yep, his ideas are so kooky that even Steve Kirsch doesn't buy them. Those of you who are familiar with Steve Kirsch will know that he believes some pretty crazy things when it comes to vaccines. But even Steve draws the line when it comes to virus denial. Not so, John Campbell. Now, I'm not going to bother providing any evidence that viruses exist. If you're that far down the rabbit hole, I doubt you're even listening to my video. But I would like to just address a few things that Rancor claimed in his interview with Steve. Oh, and by the way, if you're wondering why I refer to Steve Kirsch and John Campbell by their first names, but I am referring to Denny Rancor by his last name, is because Steve and John are both people that I have actually personally interacted with, whereas I've never interacted with Denny Rancor. And I should also mention that both John and Steve have been very nice when I have spoken with them directly. Haven't done that with John for quite a while, though, as I've explained before. Anyway, back to Rancor. First of all, his claims that doctors base their decisions on what they've seen in newspapers is patently absurd. Doctors learn how to diagnose diseases in medical school and from subsequent continuing medical education. That is a requirement to maintain their medical licenses. As for the antibiotics claim, antibiotics are effective against bacterial infections, but less so than they were thanks to antibiotic resistance, which has been exacerbated by overprescribing of antibiotics. In fact, Although less than 10% of SARS-CoV-2 infections were accompanied by bacterial infections, it is estimated that early in the pandemic, antibiotics were given to 75% of patients with COVID. Now, it is true that there was an initial reduction in antibiotic use in the first 2 months of the pandemic, although nobody stopped prescribing them as Rancor falsely claimed. Importantly, usage did increase after this, and it was correlated with COVID cases. The reason for the reduction in use early in the pandemic was because the various restrictions put in place to stop the spread of COVID also stopped the spread of other infectious diseases, and therefore there were less bacterial infections. About the ivermectin claim. It's certainly an interesting twist on the long debunked ivermectin treats COVID claims that anti-vaxxers like to use. Of course, Rancor doesn't think ivermectin treats COVID because he doesn't think COVID exists. But what about his claim that ivermectin is extremely powerful in aiding bacterial lung infections? Well, ivermectin does have effects against some strains of some bacteria in vitro. However, the concentration required for this effect, which is known as the minimum inhibitory concentration, is considerably higher than the recommended oral doses effective in the treatment of parasites, or even the dose that was once thought to be effective against SARS-CoV-2. We now know that this dose isn't actually effective against SARS-CoV-2. The dosage came from some experiments in monkey kidney cells. However, when the experiment was repeated in human airway cells, ivermectin was found to have no effect. And if you want to know more about this, Julie and I made a video about it nearly 3 years ago. And I'll leave a link to that video in this video's description. By the way, this was the first video that Julie and I ever made, and it was removed from YouTube after a few hours. I eventually got it reinstated, which is why you can now view it, but it took over a year. But if you want to go back and see how it all began, it's there for you now. But back to the ivermectin bacteria claims. Not only are the concentrations of ivermectin necessary to have an effect on bacteria way higher than typical serum concentrations, it is well documented that 93% of ivermectin administered orally binds to serum albumin, which leaves only 7% available to interact with bacterial cells. So even if Rancor was correct that viruses don't exist, his explanations for why so many people died during the pandemic are still bollocks. So how does John justify platforming this obviously bollocks report?
But of course, to do more research, we need more data. We have to have more data in the public domain. This culture of secrecy needs to stop, and we need to get all this into the public domain. We've got plenty of brilliant analysts, statisticians, doctors, data scientists, computer experts just sitting there waiting for this data. Give it into the public domain and the analysis will commence straight away. And it can show that this is completely inaccurate. Unless, of course, it doesn't show that this is completely inaccurate. This is the frustration, the not knowing, and decisions being made on us without complete data for our data scientists and statistical advocates to speak on our behalf. They are willing to do so, but they must have the data.
So John's excuse for platforming a totally bollocks report is that a bunch of anti-vaxxers that he knows haven't been given access to private patient data to do their own analyses. He fails to mention that scientists that are qualified to analyse the data have been given access and have published their studies. He just chooses not to present any of these studies to his audience. Now, there are way too many of these studies for me to cover all of them in this video. but I will just take you through a few of them. This study here is using record level data from the US. And what they've done is they've compared non-COVID and all-cause mortality following either first or second doses of the Pfizer, Moderna or J&J COVID vaccines with a matched cohort who weren't vaccinated. 6,974,817 unique individuals were included in the study, and they were aged 12 and over. Importantly, they adjusted the results for confounders to account for the differences between vaccinated and unvaccinated people. And the confounders that they looked at included age, sex, race, ethnicity, Medicaid status, history of COVID-19, number of combined outpatient and virtual visits, inpatient visits, emergency department visits, presence of frailty, Charlson comorbidity index, receipt of another vaccine within 14 days before or after the index date, neighbourhood median household income, and neighbourhood education level. And this table here shows the results. It shows the hazard ratios for mortality of COVID vaccine recipients compared with unvaccinated comparison groups. So if the hazard ratio is below 1, it means that mortality is lower in the vaccine group. And if the hazard ratio is above 1, it means that mortality is higher in the vaccine group. And they have looked at non-COVID mortality, 30-day non-COVID mortality, and all-cause mortality after the first and second dose of each vaccine. And they have also looked at unadjusted hazard ratios as well as hazard ratios, adjusted for the confounders that I went over. And as you can see, no matter how you cut it, your risk of dying is lower if you are vaccinated. Also, to check the robustness of their analysis, they looked at the hazard ratios for trauma or injury hospitalisation following vaccination and found that it wasn't significantly different in vaccinated people compared to the unvaccinated after adjusting for confounders, which is, of course, exactly what you would expect. If they had found a difference, it would suggest that there were other confounders that they hadn't accounted for. So that's the data from the US. There are also studies published looking at data from Australia, where I happen to live, and so does Sydney. And here's one of the studies here. What they did in this study was they looked at the entire population of Australia over the age of 65, which is where most deaths occur. And they specifically looked at deaths that occurred in this population in 2022 and analysed them by vaccination status. In performing their analysis, the authors also adjusted for confounders, including age, comorbidity, sex, and how often they visited their GP. There were two main waves of COVID in 2022 in Australia, and the authors did the analysis for each wave. And they did this analysis for both COVID-specific mortality as well as all-cause mortality. So what they've done in the analysis is they've used unvaccinated people as the reference group and then compared death rates in people with various doses and times since their last dose to determine vaccine effectiveness. As you can see, you were much less likely to die from COVID if you were vaccinated, and the benefits were greater if you had been vaccinated in the last 6 months. A similar pattern was also seen for all-cause mortality. And there are also analyses for various other countries around the world. But closer to home for John is the ONS data comparing death rates in vaccinated and unvaccinated people in England. They got this data by linking information from the 2021 census with people who have NHS numbers. People who can't be linked are not included in the data set. These records are then linked to NIMS and ONS death records. Now, obviously, this method means that the data set is a subset of the total population, but it does include about 91.6% of the population on the day of the census, which is pretty good. And importantly, the vaccination status of everyone in the database is known. So all this ensures that the vaccinated and unvaccinated groups are correct. But there are still confounders. Firstly, older people were generally eligible for vaccination before younger people and also are more likely to be vaccinated overall. But we know that older people are going to have higher mortality rates. So the ONS account for this by using age standardised mortality rates. However, unlike the other studies I've just shown you, there are other confounders that aren't accounted for. That being said, it's pretty clear from the data that the vaccine death numbers being quoted by John are bollocks. This figure here shows the age standardised death rate for all-cause mortality for vaccinated versus unvaccinated people from April 2021 to May 2023. The pink lines are the vaccinated and the blue lines are the unvaccinated. And just to be clear, because people keep bringing it up every time I talk about this data, you are considered vaccinated from the day you get your first dose. And as you can see, mortality rates are consistently lower in the vaccinated compared with the unvaccinated across all time periods. However, you will notice that the difference in mortality rates for the unvaccinated compared with the vaccinated does decrease over time. There's two reasons for this. Firstly, in the early months, we are seeing the healthy vaccinee effect. Basically, people who are terminal and expected to die shortly generally don't get vaccinated. Likewise, people who are acutely ill will put off vaccination until they have recovered. This means that shortly after age groups become eligible for vaccination, you will see an increase in mortality in the unvaccinated in that age group because the unvaccinated group has decreased in size and contains a higher proportion of terminal and acutely ill people than it did previously. Secondly, you can only die once. So people who have already died either directly or indirectly from COVID have been removed from the data set and therefore aren't around to die later. And we know that the majority of people in England have been exposed to the virus. So, in summary, the study that John platformed is total bollocks, and his excuse for platforming it is also total bollocks. If you'd like to look further into the data I've presented, I provided links in the video's description. And please remember, this video is about the science, but you shouldn't take it as medical advice. For that, you should speak to your medical practitioner. If you've got this far, thank you for listening. And if you've liked, shared, or commented on the video, double thank you, because that helps the algorithm and means that more people will see the video. And as I've mentioned many, many times, your comment doesn't actually have to be nice. I prefer nice comments, but even nasty comments, they help the algorithm and even get more people talking. And also, of course, thank you to everyone who has bought me a coffee or Sleepy Girl Cindy here a treat. We really appreciate your support. We will be continuing to make videos about the science in the future. So if you'd like to join the cool kids and stay informed, please hit the subscribe button. Thank you.